Rights Monitoring Agenda during a short press address at Somolu General Hospital on Thursday, 12th of December 2004, has described the ongoing strike action by health workers in Lagos State as wicked and inhuman. The strike action wishes to demand from government the implementation of the adjusted consolidated health salary structure commenced on Wednesday, December 11, and expected to end December 13th. Though the Human Rights Monitoring Agenda in the address by the Executive Director, Comrade Buna Olaiton Isiaq, gave the voice of the organization by calling on the government of Lagos State to promptly address the implementation of the COES adjustment for all health workers. He described that in reality, government continued neglect to the legitimate demand is indeed demoralizing to the affected professionals. He, however, said the office received reports on Wednesday that a woman in labor was turned back, and also a child in convulsion was also refused attendance by members of Somolu General Hospital due to the visitation by the enforcement team from the Lagos State Health Workers Association.
Go. Nigeria, we oúnjẹ ní plan. Silence of Nigeria in revolution. Nigeria is proud to be also the motherland. Greatest Nigerian people, fellow Nigerians,
Grassroots, the Human Rights Monitoring Agenda is here urgently today to address the issue that demands urgency. To address an issue that demands urgency. This has to do with the ongoing strike of health workers in Lagos State under the aegis of Nigerian Association of Nigerian Nurses and Midwives, the Nigerian Union of Allied Health Professionals, Joint Health Sector Union, and Medical and Health Workers Union of Nigeria. They are already on a 3-day warning strike, starting from Wednesday, December 11th, and to end December Friday, 13th, 2024. They are actually demanding the implementation of the adjusted consolidated health salary structure. All legitimate and deep for support. We are actually, from the Human Rights Monitoring Agenda, giving our voice. We are adding our voice. We are supporting the strike action is legitimate. HURMA is adding a voice by calling on the Lagos State government to demand urgent implementation of the COES adjustments for all health workers that is affected. All workers affected. In reality, government continued neglect to this legitimate demand is indeed demoralizing, and it will affect the professionals that are involved. However, as we are calling on government to urgently address the demands of these health workers, we are as well calling of these workers that are on strike. These workers on strike, we are calling them, they should go back to the drawing board to the plan, their strategy of implementation of this strike action. The Human Rights Monitoring Agenda got reports as at yesterday that here in Somolu General Hospital, people were turned back. Here in Somolu General Hospital, we got reports of a woman in labor rejected. Health workers here were prevented from working. We got reports of a child convulsing. In that convulsion, they rejected that child. Ongoing strike action by the health workers in the state is baseless, is in fact blind. They need to add a second thought to it. In every society, there are always consideration for special people. You have the less able, pregnant women, the age. So if any action is now demoralized to close eyes to all these sets of people, then that action will be standing against the Nigerian masses. We are here now to appeal to the government and the workers as well, health workers, to not stop anybody henceforth from coming here on emergency for treatment. That will have reduced them to a stage of animal. They will have been reduced to a lower stage of human. Then they are animals in their reasoning. They are animals, they are selfish. They are selfish. So they wouldn't mind that anybody should die because we are demanding something. As we are joining on government, as we are calling on government to promptly answer the calls, we are also calling on workers, on health workers, their staff, those people that are coming to love federal hospitals statewide. So please revisit their actions. The Human Rights Monitoring Agenda will pass this message to all our units across the state and across the nation. They will definitely confront them anybody that prevents the workers that volunteer to work to save life from doing the necessary job. That is why we are here. And once again, we are giving our voice as well to call on the government to ensure prompt implementation of these demands. This hand up is